All right, we will go ahead and get started, and I will let people in as they join. Welcome everybody to Family First Wednesdays. My name is Beth Ayers. I am the Executive Director of Family Peers for Hope. We are a nonprofit 501c3 with a mission to develop and expand family peer support across Montana, providing hope, empowering families, building connections, and inspiring change. Today, our topic is the KALM Project, and that stands for Kind Accommodating Learning in Montana. Our presenter today is Kara Green. I've known Kara for a few years now and have worked with her across multiple projects. She is a mom, a family peer supporter, and a fierce advocate. She works for Montana Family to Family Health Information Center. And I believe it was a year or two ago when you talked to me about this project. And I'm so excited that it is here. And so I will turn it over to Kara.
Thank you. Hi, everyone. Thank you so much for joining us today. And thank you, Beth, for having me. This project was inspired by a medical procedure my daughter underwent when she was 5. She's 10 now. During that procedure, we had the privilege of working with a child life specialist in another state. Through gentle preparation, including the use of a stuffed animal and toys to show her what would happen, along with mild sedation, her anxiety was greatly reduced. That experience left a lasting impression on me. I've held on to that moment as I've continued to navigate complex medical issues with my daughter. For the past 2 years, I've advocated to bring this kind of support to our community. After my 3rd attempt at a grant, I'm incredibly grateful to the Rural Institute for Inclusive Communities for providing the funding that made this dream project a reality. I couldn't have done this without my amazing team at Family to Family. I'd also like to extend a sincere thank you to Dr. Notario and Paul, our phlebotomist at Billings Clinic, for their wonderful support. Here's our wonderful team. We have Jen, Katie, Erin, me, Jobanna, Kim, and Carrie. What is Montana Family to Family? We're federally funded through HRSA and through Children's Special Health Services. We have one in every state and territory and some reservations. We're staffed by families of children with developmental disabilities, behavioral, and other healthcare needs. We provide free family-centered support to families, professionals, and agencies. Here's a list of some other programs we offer. We will be presenting at another First Wednesday in June about our Parent to Parent USA program. But here's some of the things that we do. We still have way more programs that we offer. So KALM, it stands for Kind Accommodating Learning in Montana. The kits include a general pediatrics kit, a respiratory kit, medications, radiology, and a blood draw kit. What are Kind Accommodating Learning Kits? Kits containing items typically used in medical procedures that can be used in gentle play-based activities to help people of all ages understand what will be happening during medical procedures. Kits will be available in libraries, some pediatric clinics, and MonTech. The pediatric clinics and libraries will be located in the following cities. I've picked the top populated, and I'm not going to say Miles City. No, I'm sorry, I spelled Miles City wrong. Miles City, I'm trying to get the width of the state and the biggest volume with our major cities. And so with this is a pilot program. If we can get it funded more extensively, this could span the whole state, including more libraries. And so that's the goal. The libraries, I'm looking at having the radiology kits and the blood draw kits at the libraries. MonTech would house the respiratory and medication kits. We will have the locations on our website shortly. Why are kits like this important? Medical kits that include toys can help children feel less scared about doctor visits or medical procedures. Playing with the toys lets kids learn what might happen in a safe and familiar way. This can help them feel more prepared and in control. These kits can also help children talk about their feelings. When kids use toys to play doctor, they can show what they are worried about or confused by. This helps parents and providers better understand and support them. Medical play kits can make healthcare experiences more positive. When children feel calmer and more comfortable, visits may go more smoothly and cause less stress for the whole family. Here's a general pediatric kit. These are the things. It's not, the pitch doesn't list everything in there. It will in the future have all that, and it will be up on our website. I'm still working on that brochure. So it kind of looks something like, as I'm working with a general pediatric doctor, we came up with like the most things that a child might navigate just generally in a pediatric visit. So with this kit, we're trying to address general issues that come up in primary care visits. So I found this fantastic hand puppet, but it's the teeth. So it's the gums and the teeth. And so in general pediatrics, the providers, part of their checkup or their well child exam is going to include dental, just to kind of do an overall of dental hygiene. And so the puppet serves two issues. So it's going to be a puppet so that they can show the kids like, hey, we just need to look inside of your mouth, make sure things are going okay, or let me see those teeth. And then also that puppet is served as an example to show them if they have to do a throat swab. So they can grab one of the swabs and say, this is actually what we're going to do, and this is what to expect. So it's just kind of a lot of toys mimicking what's going to be done to them. And so the throat one is pretty extensive. The stuffed animal is going to have a nose. It's a hard nose. And that's to do like a hard, because you're going to, with some of the swabs, we're going to have to swab noses. So that's just an example of like, I'm going to swab the stuffy's nose, and then we're going to swab your nose. I have this stuffed animal that has it has all of the organs, and you can like pull the organs out. So that again is like, especially youth that doesn't have a lot of words, or children that don't have a lot of words. There's lots of pointing. There's lots of, if we lack words, we need to be able to like show. So we were trying to think of things that like the kid could point at if there's a hurt on the body. And so there's this stuffed animal that the organs come out, and then they can kind of like discuss. With that being said, not just like a painful situation, but if they do need to navigate a referral to a specialty doc, that is a discussion that they can have with that doll too. And that could be like a 3 to 8-year-old kind of idea. Again, everyone has different abilities. But then I also got like an anatomy book. And so it's like these laminated pages that they can kind of go through with people of different abilities to kind of navigate that, not in like a young child stuffy form, but like more tweeny kind of and up. The slap bracelet is to mimic, just like I have got oral syringes. So that's, again, another play on immunizations. We're going to get some immunizations. Would you like to practice on the stuffed animal today? I have the oral syringes that you can practice. And then the slapstick is like the idea of like the Band-Aid, but we're just wrapping it. And so it's just this whole interaction to kind of help them navigate this. There's a couple different medications that are kind of generalized to general pediatrics. That's like a nebulizer tool, an inhaler, and an EpiPen that might get prescribed to them, and that provider might want to just talk to them about them and show them. So that's part of the kit, so they can navigate that. That cute little girl in the picture showing one of the examples of the nebulizer. The respiratory kit, that's a little bit more complex. And so that's why MonTech's going to have it, because there's way more complex things that children, not just like an everyday kind of thing, like they might get a referral for some of these things to like a pulmonologist or to another provider. And then that they are more than welcome to check that out through MonTech, and take that to that provider's office and say, I'm going to get a CPAP. Can you show me what that's going to look like on my stuffy or my doll? Can you show me what, the oxygen, what that looks like? We've got the little oxygen set here, what that looks like. And so they're able to kind of show the kids before they get these procedures. Medication, again, there's some more complex medications involved. And so, as you see, there's the EpiPen on the mermaid being illustrated on the mermaid, but there's way more. There's feeding tubes. There's all kinds of things that, again, someone could check out and take to the provider that's going to either is giving the referral or is going to put those in if you're going to get the procedure for those. The radiology. This is going to be one that I'd like to house at some libraries. Just general ultrasound. So you have the liver, kidney, bladder, lung, and echo. So those are all things that complex medical issues. My daughter's had a few of these things go on. So we've had to navigate radiology studies, a plethora of different radiology studies. So she got to take advantage of trying them out on all of her stuffed animals that she wanted to. But and then we've got the scope. And so that kind of comes into play also with some more complex medical issues, but it still falls under radiology. So I wanted to incorporate it into radiology. And then the blood draw kit. So I would have loved to have all the stuff. I'm still waiting for some of my other blood draw stuff to come. But again, I needed a vice to be able to have in the bag for the phlebotomist to say, this is what's going to happen. Would you like I can do it on the cat first before we do it on you. I can show you what we're going to do on you, and then you can do it on the cat. So I picked the bobcat because it's got some scratchers, it's got some nails. But with that being said, there's also going to be a book included in that kit. There's going to be like a butterfly needle IV tool, so they can strap that around, because for pediatric patients with blood draws, they try to do it differently than adults do. They try to do more vials all at once, or they try to do it in a big tube, then they turn it away. They're trying to quickly do this instead of us as adults, we sit down and they slowly pull the blood into all the different vials. But for kids, they do it in one big swoop. And so it's just another example of what's happening to them. And then I found a fake hypodermic needle that it fills up with blood, so they can practice on the stuffed animal while they're sitting there trying to do it. And then the slap bracelet is absolutely just for them to pretend that it's a Band-Aid. It's still wipeable, obviously, if someone would like to give a Band-Aid, but we were trying to make it so that it's wipeable and cleanable. And then I wanted to add some more of those oral syringes because they're easy to play with, and my daughter has significantly played with those in so many scenarios and with different stuffed animals. And so that's just, again, easing that anxiety, playing, making it not such a big deal. Does anybody have any questions about the kits while we're here? Amy, do you have a question?
I think there was one in the chat.
Sure.
Amy asked, would PEDS offices be able to purchase a kit for their office?
Absolutely. If they are interested in so I am going to have like sheets with the purchases, the links, everything for people to purchase. My goal is I'm giving these, like the funding is me giving these to all these different entities with the hopes that they are going to see the different options for kits and maybe find the funding to purchase them on their own. Um, I I do want, like, that's why we want MonTech to have some of these, the libraries to have them, because they're for youth with special healthcare needs and adults with special healthcare needs. So I there's a range of people that I want to have this option. That the provider one, absolutely. If anyone is interested in it, I will get them all the tools and all the information they need to purchase that in their clinic. Mm-hmm.
I have a question. How many of each kit are you going to have?
So MonTech, so I'm trying to be able to have MonTech and Missoula have the two respiratory medication, and then in Billings respiratory and medication, so that there isn't like a hold time on it too long, because I really want families, especially those two kits, because they are a little bit more complex, to be able to check them out and like navigate that with the provider, and the provider kind of walk them through some of the stuff that they might have happen. Same with radiology. So that's why at the library, and part of my grant is absolutely to collect data. So I am collecting data to see like how many times these were checked out. Obviously, I would love, with the list of all the kits and all the things that go into them, libraries to say, hey, this was pretty popular. We only have radiology. We would love the blood draw kit. So like the goal is that everybody start wanting more of these and to bring them on themselves and say, yeah. And I'm using a few different products, right? I'm getting it through two different entities as far as like all the different products. So yeah, sometimes it takes a little bit longer. So I'm waiting on a couple things, but hopefully all of that stuff. And I'm working on a brochure. My brochure is going to be like dialed in. I'll have all that stuff, worked out in my brochure.
Okay. Charmaine put in the chat that she would also like the information sent to be able to purchase a kit. So if you want to get me that info, and then I can share it out to everyone on how to purchase a kit. And then Carrie asked, will these be showcased at the Montana Council for Exceptional Children's Conference next week?
I'm not sure. I think that I have a coworker going there, but
I'll be there, and I can print some flyers to take.
Katie, Katie can help me.
This
And
is Carrie. Yeah, sorry. I knew Katie was going to be there. I just didn't know if because I was like, this would be such a great opportunity to show these off. They're incredible, Kara. I never got to see like the actual components of it. It's amazing.
And so, Kara,
Thanks.
will each of the libraries you listed, those towns, will they each have one of each kit except for the ones that will be at MonTech?
So they're willing to take one kit on, and I don't know if I can afford to give them two. It's my dream to get them both those, continue, the blood draw and the radiology, because that's something that we have to continuously do, or, they're pretty normal. But well, I'll keep working it, right? I'll keep talking to them. Libraries do get funding. If they really like them, maybe they'll ask for the list and they'll want to buy them, is the goal.
Amy.
It would be really cool if, because we have the wellness events every quarter, to have somebody come in and give a demonstration.
Yeah.
And this was what you were talking about, Dakota, doing videos?
Yeah. I asked, yeah. I wanted some adults and children with special healthcare needs to do some videos, and so we can put them on our website. So I'm working on some videos next week with a child. So yeah.
Teresa in the chat said maybe local hospitals or clinics would purchase for libraries to have to check out.
Yeah, I am working very closely with a doctor that is with Billings Clinic, and absolutely have we tried to pitch this a few times. We will continue. Now we have some examples, and we will continue to pitch it to them. If you know me, you know that these things are very important to me, and I will continue advocating. And so, absolutely, if we can show, especially with the provider that I'm working with, if we can show that this absolutely does make a difference, absolutely, let's get it into as many places as possible. I'm game for that. Does anybody have any more questions about this? Because
I just have, what is the cost of a kit? Like just like an average.
Sure. I mean, the pediatric, the provider one, we're looking at around $200. Some of them are a little bit cheaper, but yeah,
Okay.
they're not outrageously expensive by any means. What we're going to have to navigate with the library is, you know, the wear and tear on it, how it survives. Like I got to track all that kind of stuff and see. I understand in a provider's office, that's a little bit more, you know, someone's watching over it, someone's in the room. These kits are only, I have to clarify, these are only for 3 and above. So they do need to be watched when you're in a room with a child that's younger than 3. They're not recommended for under 3. So it's absolutely 3 and above.
Okay. And then I just wanted to add that the ones in MonTech provides free shipping, correct?
Yes. So MonTech does free shipping both ways. And yeah, ideally, I would love to have them in the Billings location, so it would be a little bit quicker for families. So that's my goal. Yeah.
Okay. And I just have a couple more comments real quick in the chat. Teresa asked to let her know what's arriving in Miles City, and she'll approach the hospital foundation to purchase additional items. And then Melissa said, I've recently had to have a stoma and have been working on a way to help my preschool students understand. Sometimes the stoma interrupts our class. Do any kits go over GI issues?
Yes. Yes. I mean, I worked in radiology, so I worked in lots of departments in radiology, and the toys that I have for radiology don't obviously give me the extensive component that I would like, although there's the combination of some of the respiratory or the feeding and the radiology combo that, you know, maybe we could make something up. That just has to be like a conversation that someone has with me. I totally understand. Like there's some of the radiology studies that my daughter had. We don't have any toys, but she understands the idea a little bit. And when I say the reason why this is so crucial is it's so children with special healthcare needs, especially, that's what I'm navigating. I mean, just for instance, my daughter, she was getting a pain. I know this is like super crazy, but like she's getting a pain right here. And when someone has anxiety, especially with medical procedures, which she does, we aren't even allowed to talk about immunizations in the room. So when I ask the questions, I have to like portal message to ask these questions because there's such anxiety over it, right? But for instance, this is what happened last night and this morning. So my daughter feels this pain right here. She internalizes it, doesn't tell me that she has like a pain right here, internalizes it, thinks that because there's so many children in her school that are getting their tonsils taken out, that she's now going to have to get her tonsils taken out. But I have no idea that this is swirling around, right? I don't know this. She's completely like lost her mind an hour before bed, just ridden with anxiety, so stressed out, won't stop crying, thinks that she's going to then have to get her tonsils taken out just because she has a pain right here, right? Now for an hour with lots of tears and anxiety. I have to calm her down and say, I don't think that that's what it is. We don't have any schedules to get your tonsils out, just like calmly, right? Then the next morning for 2 more hours, I'm navigating it this morning, right? And so it is absolutely something that happens. I'm dealing with medical anxiety significantly, right? And so when we were playing with these toys, like the photos or all of her playing with them, she just said to me, all like as we're playing with them, I'm not getting into these, right? I said no. I said no. But that is absolutely some people's experience with medical procedures. And so this, I really, really hope helps children. So that's my goal. And please reach out to me. I'll put my email in the chat. Please send me emails, questions about it. And then I wanted to show you guys something else. Yeah. Does anybody have any more questions about this? No. Okay. I wanted to share another program. Wait, I'm gonna go back. Sorry, I'm frozen. Here we go. So I just wanted to take a minute to tell you guys about another program that simultaneously I've launched, that we're launching too. So I just want to give a little just a little background. We have a group. It originated with a circle of parents, and our group is called Montana Family Connections. And at my first Montana Family Connections meeting, it became very clear that there's a major lack of respite services available to families across Montana. Even though policies have changed, families are still struggling to find the support they need. Family to Family came up with an idea to help bridge the gap by connecting students and families. In the past, when a family qualified for Big Sky waiver and had respite or socialization services included, families could lose their waiver if they couldn't find someone to provide these services. That is no longer the case, but the need for respite has not gone away. Families continue to need reliable, supportive services, and this project is designed to help meet that need. So the idea is we're linking colleges and universities offering work to students and connecting them with families. Montana Family to Family doesn't hold liability. The school doesn't hold liability. We are just connecting to people that need work and services. And so what it would look like, I can give you an example of what it would look like for me. If my child has Big Sky waiver services, she qualifies for socialization and respite services. Part of that is I need to find someone, and I need to screen the person as the parent. So I need to look at my friend's family and say, oh, hey, could you take that on? Could you take my daughter to a movie? Could you take her to the mall and walk around? Could you take her to the park? Ideally, what I would love is for someone to come to my house and just do crafts with my daughter for socialization and respite. I work from home, so it would be very amazing for me because it would take us some time to get to know each other before I let my daughter in a car with someone else. With that being said, I've sent we have like an about me page, and so what it is like they get this information, like the university will get this information, and the parent, myself, will fill out a sheet that's about my daughter and like her needs, what she's struggling with, what she likes to do, her do's and don'ts kinds of things. And then and then the student gets to see that, and the student decides if that's a good fit for them, right? And so this is the program in a nutshell. We are trying to connect students that need part-time work with families that need respite and socialization. And it just so happens that University of Montana has been fantastic about this program and has just sent this out to the psychology students, the occupational therapy students. I've sent it to the occupational therapy, and the SLP program at the University of Montana. I've sent it to Rocky Mountain University of Montana Billings, or I'm sorry, Montana State University Billings, Rocky Mountain College, and St. Mary's. So we're trying to get it out to students that would like part-time work. Someone could come over to my house for 2 hours on a Saturday and hang out, get paid. The way that they get paid is through Community First Choice. So if I am a paid caregiver through my home care organization, that's how that person would get paid. They would just fill out an application and they would get W-2, W-4, and they would be paid through that organization. Does anybody have any questions on that?
So Amy put in the chat somewhere, I have a brochure set up, got from MYLF and Aspire. Could also get a hold of University of Mary.
Okay. Yeah. Absolutely.
And then Charmaine said the Montana Lifespan Respite Program out of Miles City would also be a great program to see if they could help with this as well.
Yeah, absolutely. Their program, with that program, you can't have waiver services and qualify for the respite, the lifespan respite. You can't have any waiver services, and it's only $700 for a full year. And you have to send in quite a few receipts and information for that. So it is a bit overwhelming. That program does facilitate children with disabilities, and then aging adults with disabilities. And so, yeah, it's a $700 max, and you can't have waiver services. So this program, with waiver services in mind, so that people could get help. If with our program, if you wanted to private pay, if like you wanted to utilize this to private pay someone, absolutely. That's a negotiation and something that you can talk to someone, personally when you're interviewing people and talking to them. We were only trying to fill a gap of a need because of waiver services with this, because families just don't have this.
And I think that might have answered Amanda's question. Would a family have to be on a waiver program, or can any child be involved? I work with kiddos 0 to 3.
Yes, absolutely. Anybody can be involved. Yes. Mm-hmm. We're just trying to connect. And one of the professors at the University of Montana said that they might even incorporate that program into their program to kind of help aid that connection, because it does kind of help the student population to kind of know what it means to work with people with disabilities, right, of all ages. Mm-hmm. And this is offered to adults too. We're not going to say no to any adults, so it's absolutely for adults. It's just for everyone. We know that this is an issue and we want to help.
Kara, can I just clarify or ask a question for the clarification? In terms of who can use the program, in order for a family to get money to pay for a caregiver, they need to be on the waiver or CFC, correct?
Yes. So Jen wanted to make sure that if someone wanted a private pay, they knew that they could private pay. But for us, for waiver services, for like you or I that would want to participate in this, we need to connect that student with our CFC, our home care organization, so that they get funded. Yes.
Thank you.
Couple more in the chat. Amy said it's a trifold brochure, the About Me brochure. I think that's a question.
Oh, sure. It's a PDF, and I can email it to you. Just shoot me an email and I'll email it to you. Yeah, I can email it to you.
And then Teresa commented, appreciate you're looking at meeting a need within waivers, but there's a lack of people to provide respite.
Yes, that's why we're really trying hard with all these students, because we know, especially the students that are in master's programs, they're looking for, like, I don't want to say extreme part-time work, but as I took a tour of the St. Mary's occupational therapy program, I was there for like an event. And then of course, like, I asked a million questions because that's just what I do. But I asked people that were there, and I asked the professor, what do their hours look like? It's weekends, it's some nights that they have available. So it's just a variety of people. And at the University of Montana, a bunch of undergraduate psychology majors were interested. And so their schedule is a little bit more opened than someone in a master's program.
And then Jennifer commented that the lifespan respite can have a waiver service. So maybe for those folks that are interested in that, to just go ahead and contact Lifespan Respite and kind of find out if that fits your specific situation. And then Katie put the All About Me form in the chat.
Thanks, Katie. Yeah, maybe they changed the waiver, but when I applied for that, she said that we couldn't have waiver services if we were participating in that. So maybe it's changed. Yeah.
Okay.
Does universities or the home care provider do a background check?
So, good question. I had a couple of families answer. So when I participate in CFC services, my organization, as a parent, it's up to me with any of the respite, lifespan, or this program. It is all up to the families to do backgrounds and like figure that out. It's all up to us. But with my home care organization, I can pay as a parent an extra $10 to have that application background checked. So when you're doing that, you absolutely can ask your home care organization, can you background check them for me for an extra fee? And what I guess the difference between lifespan is the person has to do the respite and then you ask for the money. And so like either you pay out of pocket to that person and then wait for the check, or wait for the check to pay the person. This is, they fill out the application, they download it onto an app, and the check comes to them, either direct deposit or that money is just, it's all, since they're technically an employee, they're paid and we don't have to worry. As a parent, I don't have to worry about it. It's just all taken care of. I'm going to just, I have 2 more slides and then if somebody has more questions. So I just wanted to circle back because Montana Family to Family is a peer organization. So what is peer support? Peer support is when a person with lived experience, such as raising a child with disabilities or managing their own health conditions, supports someone going through a similar situation. Peer supporters often emotionally support, share practical tips, help people understand systems like healthcare and education, and connect them to resources. They walk alongside people as they build skills, confidence, and knowledge. Peer support helps people who understand, reduce isolation, and can make it easier to navigate challenges and access services. Here's our information. It's free. We don't charge people to contact us. And like I said, we will have all of these things. Our website is under construction. And so we're going to have the locations of all the kits on there for you guys, the pediatric offices, and the addresses to the libraries, and obviously more respite information for you guys.
Well, thank you, Kara. Are there any questions? Additional questions? All right. Well, thank you so much, everybody, for joining us. Thank you, Kara, for all the fabulous information. And thank you for just your advocacy in seeing a need and just going after it and filling it. Your dedication and support to children and families is inspiring. And I love that this work is coming to fruition for you. So we will look forward to the locations of those kits and the brochure and flyer. Again, whenever you get that finished, if you want to send it to me, and I'll send it out to everybody.
Yeah.
All righty. Well, we'll give you guys about 15 minutes back to your day, and we will see you all next month for Family First Wednesday. Thanks, guys.